Concussions and traumatic brain injuries are what we're discussing for AIDS today, so please join me for today's discussion. Here we go. Concussions and traumatic brain injuries, or TBIs, require immediate medical evaluation, careful rest, and monitoring. And when injuries are moderate or severe, emergency care, possible surgery, and structured rehabilitation. Mild concussions usually recover with guided rest, while moderates, severe TBIs need hospital level treatment and long term therapy. What to do right away after a head injury? These steps apply to both concussion and suspected TBI. Seek medical evaluation if mild symptoms can worsen hours later. Watch for danger signs such as worsening headache, repeated vomiting, confusion, slurred speech, weakness, or seizures. Avoid another hit. A second injury before recovery can be dangerous. Treating a concussion, mild TBI, grounded in CDC and Mayo Clinic guidance. Relative rest for 24 to 48 hours. Limit activities that worsen symptoms. Screens, reading, heavy thinking, strenuous exercise. Not strict dark room. Rest. Light activity is okay if tolerated. Gradual return to activity. Start with light walking. Slowly increase school/work tasks. Stop and rest if symptoms flare. Pain management. Acetaminophen is typically used early. Avoid NSAIDs initially because they can increase bleeding risk. Monitoring. Have someone check on the person for the first 24 hours. Return to sports only after fully recovery and medical clearance. Treating moderate to severe TBI. These are medical emergencies, folks. Okay, emergency stabilization. Ensure oxygen supply, blood pressure, stability, and protection of airway and spine. Imaging and monitoring. CT scan to detect bleeding, swelling, or skull fractures. Intracranial pressure monitoring if swelling is significant. Medications. Anti-seizure drugs first week. Diuretics to reduce brain swelling. sometimes coma-inducing medications to reduce metabolic demand, surgery used to remove blood clots, hematomas, repair skull fractures, stop bleeding, relieve pressure by creating space for swelling. Okay. Okay, here's the rehabilitation part. Rehab often includes physical therapy, occupational therapy, speech and language therapy, neuropsychology, social work / case management. When to seek emergency care. Call 911 or go to the ER if any of these occur. Worsening headache. Repeated vomiting. Seizure. Weakness or numbness. Slurred speech. Increasing confusion or aggression or agitation. Loss of consciousness. Long-term considerations. Some people develop post-concussion syndrome. Symptoms 4 weeks. Moderate to severe TBI may require long-term cognitive, emotional, and physical rehabilitation. Repeated TBIs increase risk for chronic traumatic encephalopathy. Water on the brain, guys. 4, you'll work with families and caregivers in Meadville. If you want, I can turn this into a caregiver-friendly handout, a podcast segment online, or a myth-busting one-pager tailored to your audience. Short takeaway: after a concussion, the most important actions are medical evaluation, 24 to 48 hours of relative rest, symptom monitoring, and gradual stepwise return to normal activity. The goal is to protect the brain while it heals. And prevent a secondary injury. Below is a structured caregiver-friendly guide you can use in your work with families in Meadville. What to do immediately after a concussion. These steps apply to adults, teens, and older adults. Get medical evaluation. Even mild symptoms can worsen. Watch for danger signs, worsening headaches, repeated vomiting, confusion, slurred speech, weakness, or seizure. Avoid a second hit. A second injury before recovery can be dangerous. First 24 to 48 hours, relative rest, non strict bed rest, but no pushing through symptoms. Light activity only, short walks, simple tasks. Limit screens, phones, TV, computers if they worsen symptoms. Avoid strenuous activity, exercise, heavy lifting, yard work. Avoid alcohol and anything that impairs judgment. Have someone check in for the first 24 hours. What to avoid early on? No driving if dizzy, foggy, or overtired. No sports or activity with fall risks. No NSAIDs early, ibuprofen, naproxen, because they can increase bleeding risk. This is general medical guidance, not a personal directive. No, no toughing it out. Symptoms are signals, not inconveniences. Days 2 to 7, gradual return to activity. Use symptoms as the guide. Light walking is usually tolerated. Short periods of cognitive work, reading emails with breaks. Increase activity slowly. If symptoms flare, step back. Return to school work with accommodations if needed. Shorter days, reduced screen time. When to seek emergency care. Call 911 or go to the ER if any of these occur. Worsening headache, repeated vomiting, seizure. Weakness or numbness, slurred speech, increasing confusion or agitation, loss of consciousness. These can indicate more serious brain injury. Recovery time. Most people recover in days to weeks. Some develop post concussion symptoms lasting 4 weeks. Older adults may recover more slowly and need close monitoring. For your caregiver and community education work. Okay, guys, that is A for you. I'll be back on with B shortly. Give me a bit for B, please, and I'll be back on with that for you shortly. For now, Gator Wellness, take care, folks.